Dr. Jeannie Elling, thanks for having us here at the University of Cincinnati. We're enjoying it. Let's talk about the risk factors now, a closer look at portopulmonary hypertension and the impact it has on patient survival.
Okay, very important question. So now, common sense would say that the sicker your liver is, the more likely you are to develop portal hypertension, but absolutely not the case. You can have very mild liver disease and have significant portopulmonary hypertension. In that case, the portopulmonary hypertension will limit your life expectancy more than your liver disease. And I'll show you a little bit data about that in a second. What we know is that we can't even tease out and say the worse the portal hypertension is, the more pulmonary hypertension you'll develop, because that doesn't correlate either. It's a separate process. What we can say is that females are more likely to develop portopulmonary hypertension than males, and patients who have autoimmune hepatitis as the etiology of their cirrhosis also have increased risk of developing this condition. If we look at the data on survival, our survival is significantly impacted by the development of portopulmonary hypertension based on what we have available to us, and that's based on some registry data and a series of patients. If you look here, you'll see from 2008 they followed 154 patients with significant portopulmonary hypertension, mean pressures in the 50s, people that you could not transplant, and they found that the 5-year survival in that group of patients was above 60%. And they found that low cardiac output and the presence of cirrhosis were correlates with outcomes in terms of mortality. Now, if you look at the REVEAL registry from the US, Croco published this data in 2017. Again, significant pulmonary hypertension with a life expectancy that was significantly limited, 40% 5-year mortality. But that did not collect data on their liver disease, so we can't say how it correlated with the status of their liver and their functional class. We can just say that it was associated with shorter life expectancy. Now, if you look at the UK data, they found very similar things. They found that patients on average had significant pulmonary hypertension, means around 50, with high PVRs around 8, and those people had a 35% 5-year life expectancy, so very diminished from what you would expect in any individual or a person affected by mild liver disease. In that group of patients, they had no effect from cirrhosis and no correlation with their hemodynamics or functional class. So very hard to predict who would have worsened outcomes. Just the presence of portopulmonary hypertension was your risk factor.
So if somebody's watching this and listening to you, and maybe they're asking, how do I manage these differences in numbers in patients?
I think what you always have to remember is that older data had less drugs available. And there was a time which we didn't even know if we should be treating these individuals. So I think what you have to say is we're starting from this bar, which is about 50% 5-year survival, if we just mix these studies, these registries together, and we only have room for improvement. So what we have to look at is we have an impaired population, a high-risk population, but we are hopeful that we'll be able to impact that with drug therapy for our PAH. So we have a lot of work to do in this area, but I have hope that we are impacting the outcome.
Like the way you think.
Thank you.
Thank you.